I'm very happy and honored to be facilitating this very important conversation this evening. This is the part two of the health activism. Just to give you a theme of what this session is based on, really, what we're going to be looking at is how do women protect health? How do women protect their health at the time of a physical danger and a social unrest? What are the biggest health challenges facing women today, and where do we get help when you are cut off from your usual support system during this life in lockdown? Does the suffering of the wider community bear down on a personal well-being, and how do we achieve health justice for women being left out of a global health infrastructures and conversations? I would like to welcome my very amazing panelists. I'm going to give descriptions of who they are. I would like to welcome Hilda Kuleba, has over 40 years experience in working in public health and leads mother-to-mother work in Mozambique, where she is responsible for the implementation and strategic leadership of the program in the country, while ensuring alignment and integration with the Ministry of Health plans. And my second guest, it's Nina Prasad, joined the public health team at Bloomberg Philanthropies in 2008. She led the development of Now Directs to the Foundation Obesity Prevention Program, which aims to improve the food environment policy through change. Nina also directs the maternal and reproductive health. And my other guest, Devita Davidson, Executive Director of Food Lab Detroit. Food Lab is a nonprofit organization that fosters the creation of equitable local food economy by providing food entrepreneurs with education, peer-to-peer mentoring, and access to market opportunities. Welcome, everybody, and thank you for joining us this evening. I know we're all in different timelines. So I really want us to have a really open conversation. I know it's very difficult during this time with virtual, but hopefully we will be meeting very soon in person. So I would like to open with this question. So this conversation is extremely important. Why is it so important? Why right now we need to really be making sure this conversation is being had? I will start with Ilda first, if that's okay.
That's fine. Thank you, everyone, and I'm very excited to be on this panel. I'm Ilda. I'm the country director for Mothers to Mothers. We're an African-based organization whose mission is to deliver healthy, thriving families and a generation free of HIV. For Mothers to Mothers, it's about giving African women a voice so that they can make decisions on their health care, on their being, around their bodies. And it's about being gender equal, inclusive, and really looking at building capacity from the ground up. So for us, it's important. This conversation is important because we know that women are affected disproportionately when it comes to health. So it's important for us to talk about this. As an organization, we employ HIV positive women as mentor mothers who work in under-resourced facilities and communities, and they're there providing a link to essential services to their clients, but also providing health education, information, and really providing that psychosocial support. So it's important to have this pillar, this lifeline of women who've been there, who've had the same experience. And I think it's important for us to talk about this around this pandemic, around so many issues going in the world with anti-racism, because women are at the center of what we do. And I think that women create healthy societies, healthy families, and this is why it's important. As an organization, we've employed over 11,000 women, all HIV positive. We've reached 11 million women and children under 2, and really all with the objective of having a generation free of HIV. So I think that it's important because we really want to make sure that we improve the livelihoods of those that are most marginalized in our society.
Thank you, Olga. Nina, over to you.
Thank you, Layla. It's really nice to be chatting with you and Hilda and Devita as well. So I'm a physician and I did some training in public health. I work for Bloomberg Philanthropies, where I oversee our food policy work and our maternal and reproductive health work. I'm fortunate. I'm a Canadian, but I normally live in New York City, and I'm really lucky that I get to work all over the world. Um, I don't think women are a monolith, so I think we need to be careful about, or I'm very careful about how I talk about women and represent them. So I just wanted to put that out there. And even within countries, women can have different needs. So it's something I'm really aware of and sensitive about.
Mm-hmm.
Um, women, having said that, though, I think nobody would disagree that women are the backbone of society. We're the backbone of families, which mean then we're the backbone of communities and nations. And I believe that when women thrive, society thrives. And I don't think anybody would disagree with that, yet we continue to be left out. And emergencies like the COVID-19 pandemic amplify the inequity, and we're seeing that already. They'll amplify the inequities women around the world are already suffering from, whether that's in the health sphere, the social sphere, the economic sphere. So, and to dig into those a little bit, in health, we're already seeing redirecting of resources. So, I recently came across a study that looked at what happened to services for women during the Ebola crisis in Sierra Leone in 2014 and 2015. And very conservative estimates there show that as a result of decreased utilization of health services, there were an additional 4,000 maternal deaths, neonatal deaths, and stillbirths. We're seeing reduced cancer screenings around the world. We're seeing reduced access to contraceptives, which means we're going to see more unintended pregnancy, more unsafe abortion. And again, getting back to Sierra Leone, they observed during the Ebola crisis an uptake in teen pregnancy, which was attributed to school closures. And I wonder, where are those young women today? What do their lives look like? Did they go back to school? So there's the health and social impacts, and then there's economic impacts. And women work in what we now realize are so many essential jobs, whether it's frontline healthcare workers, whether it's grocery store clerks, whether it's cleaners, and we really undervalued these and underpaid and underprotected these positions. But I have a little bit of hope. I hope we're turning a corner on that, and we're now appreciating who are the people, largely women, who keep our society going. So, and then of course I don't have to say that as we're all sheltering in place, women are sort of dealing with a triple duty. They're doing their regular jobs. They're acting as teachers for their kids while their kids are at home and not in school. And then they're looking after the household, and that has implications. So, it just, women do everything, and we've got to start lifting them up. And I think this pandemic is also showing us that we're not resilient. We're so vulnerable. And how do we create systems of resilience so we can, weather the next crisis and the next pandemic, which will inevitably come? And women are going to be a big part of that.
I feel like any crisis that's ever happened in the world, you will find women are always at the forefront. of keeping everything together, whether it's within their homes, within the crisis that's happening outside. So I think that's something that, even for me, it's something I'm constantly seeing. It's like the women is at the forefront of this. Davita, how about you? Why is this so important that this is at the forefront now?
Yeah, I think it's super important, particularly during this time in a pandemic, yes, but also as particularly we see here in the United States in America and really all over the world, that people are starting to say in a unified voice for the very first time, Black lives matter.
Yeah.
And if Black lives matter, then Black women's lives should matter. And so my work at Food Lab Detroit is that of the executive director, who has the privilege to oversee an organization that helps women, primarily women of color, start their own food business. And to be honest, like, I don't do this work because I'm interested in launching and scaling and growing large mega food businesses owned by women. The reason why I do this work, and is centered around the fact that we cannot disconnect poverty and poor health. And what we know is that women disproportionately are affected by poverty, and as a result are affected by poor health. And so you cannot separate those two. And so the thing that I'm most interested in having this conversation around health activism, because that's the title of this panel, is the fact that I want to make sure that we lift up and continue to bring awareness to the radicalism that is health activism. And what I mean by that is that I fear that the politics of terminology that's called self-care has been muted, has been taken over, and has now been made palatable for the masses. But the whole terminology of self-care really comes from kind of radical politics. So in 1988, in the words of an African-American lesbian by the name of Audre Lorde, and is our rowdy cry here in Detroit, my community, that is caring for myself is not self-indulgence, it's self-preservation. And the act is political warfare. And so I really want to center my work around what does it mean for women to be radically and unapologetic about their self-care. Because many of us are poor, many of us are working ourselves into the early grave, and to say out loud, I am going to take care of myself, I am going to put myself first, like, that's radical within itself. Because so many times what we know is that even women, we aren't conditioned to believe that. And so now is the time for women to say in an unapologetic manner, then my life matters. And self-care to me is really a political and a radical act. And what does it look like for women in this moment, who are out on the forefronts of protest lines, who are out on the forefront of essential care workers, to say, I matter too. And so how do we have a conversation around what self-care and the radicalization of that, what it really looks like?
Listen, I feel like I'm about to jump out of my couch. Like, just want to high five all of you, because that's exactly, really personally, I feel exactly the same way in terms of well-being. It is like the idea of the well-being is a political statement. And also, I'll give you an example what I recently experienced. As a therapist, I thought, what do I do during the pandemic? And I thought, okay, let me organize Zoom calls where people can just come in and just talk about how they feel. But we did one recently with the recent, obviously, of, I would say, reawakening of the civil rights movement in America, which is happening also here in the UK. And yet again, Black women were left behind, And I remember we put out a notice within 24 hours, we had 4,000 women around the world who contacted us, who wanted that space, because we still don't have those spaces where we can explore the idea of well-being. So I really want to expand on what all of you have been saying in terms of, because this is not just about gender, it's not just about being women. If you are a woman of color in a country where racism clearly exists and class system clearly exists, maybe briefly all three of you can share the impact that will have. Because there is a difference. I think privilege needs to be pulled out when we're talking about this. And Davita, I'll start with you actually first. Yeah.
Hi, boo. I'm on a call right now.
I love this new world.
Yes, yes. This
So
is
what
my
what
little, this
impact?
is my niece, Aaliyah.
Oh, hi,
Yes.
Aliyah.
Okay, I'll talk to you later.
So yeah, maybe if you can give us some points on how the impact that will have, because we can talk about women, having access to health, but we have to be honest. There's a whole different need for Black women specifically for health. So maybe if you can say to the audience the impact that will have if those women are not left behind. So David, over to you, David. Sorry.
Oh, sorry about that.
Yes. Yeah.
Yeah, so
Yeah.
so 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 that's very important specifically. So what I want to do, and I can't wait to hear from my panelists, but what I would love to do is take a step back, right? For a second, and really get to the root of this, like being left behind. And I want to make sure I call out, and for the folks that are listening, two kind of really historical texts that I want to ground us in. One
Mm-hmm.
is a book that is written by someone who I have a great deal of admiration for. Her name is Harriet Washington. And she wrote a book that's called Medical Apartheid, right? And it talks about the history of medical experimentation on Black bodies,
Black women. Yeah.
particularly Black women. And then I would love to kind of draw this thread and this connection between another book that's called, and it's taken from the call from Fannie Lou Hamer that says, "I'm sick and tired of being sick and tired." And so if you would allow me to talk about the fact that there is a history, particularly in the United States of America, from the era of slavery to the present day, where Black people, Black women in particularly, have every right to be suspect of our medical community, to be suspect of the medical industry. Our bodies have been taken advantage of unwillingly, like we have been experimented upon. I think what is most known all across the world is this syphilis experiment that we call the Tuskegee experiment that was done on Black men. For Black women's bodies, our uterus were being removed. One of the things that we see now, because Serena Williams and Beyonce Knowles lifted it up, that they almost died on the operating table as they were giving birth, because for whatever reason, doctors don't think that Black women have pain. Like, where does that come from? Or that we can take it? We're strong. We're tough. Like, the fact that we're in pain, they don't believe us when we say that we are. And so, but so there's history rooted on why we should be suspect of modern medicine and even the medical industry today. But the reason why I want to hearken the book that was written that's called "I'm Sick and Tired of Being Sick and Tired" is that Black women have always been like the backbones, the architects, the workers in the background to create this medical kind of care for Black women, because traditional and modern medicine has failed us. And at the forefront of that is midwifery. Like the midwives movement among Black women and taking care of Black women, making sure that our babies are delivered in the world in a way in which we're treated humanely. Our pain is being recognized. And so there is a history upon history around how Black women we recognize. And I have to say this about being left behind. I think another reason why the contributions of Black women, or we are being left behind, is not brought up to the forefront, because in the United States of America, primarily, like cisgender Black men tend to be centered, right, in these movement building exercises. So whether it be Booker T. Washington, Dr. Roscoe Brown, like, yeah, these were Black men who really had conversations and were leading the movement around, like, what does it mean to be health activists? But don't think Black women were not in the background who were the forefront of these movements. They were nurses, they were teachers, they were club members. A sorority here in the United States called Alpha Kappa Alpha. They even had something that was called the Alpha Kappa Alpha Mississippi Project. So it is important, yes, that not only Black women be left behind, but we let Black women lead. We need to be listening to Black women, because we, more than anything, our bodies lay at the intersectionality of not only being women, but being Black, being trans, being non-gender conforming. And I know that Black women have the solutions. We understand that health And medical needs is a community action. It requires us to be in community with one another. And so I think that the path has been laid and been set. But I think that in order for Black women to not be left behind, we have to listen to, we have to center, and we have to allow Black women to lead.
Thank you. And Ilda, do you want to have something to add on that point?
Yeah, I mean, I think if I bring this back to, I think there are a lot of points of what Via brought up around letting Black women lead, listening to them. And when I bring it back to the work that we do at Mothers to Mothers, I think there's a lot of things that are very relevant. I mean, if you look at Mozambique, a country where we have 2.2 million people living with HIV, and 58% of that number are women. So, and only a small fraction are actually on treatment. So unless we do something, unless we make sure that these women know their status, get on treatment, we will not be able to achieve the goal of a generation free of HIV. There's no way. So the role of the mentor mother, which I mentioned earlier, is very pivotal in what we do. It's important to have peer-led, community-based interventions that allow us to know what are the challenges that are going on in our communities and how can we help. So the solutions need to come from the communities in order for us to be able to serve these women, because we can't come in and with the solutions without knowing what is going on. I mean, there are so many cultural that goes on that doesn't allow women to access healthcare because it doesn't depend on her. Many women, specifically in Mozambique, early childhood marriage is a thing. So a woman doesn't make a decision around her healthcare, around her well-being. It's a privilege to be able to make it to a facility. And so I truly do believe that there's so much that has to be done in this space. And I talk about HIV because for us, HIV is not something of the past. And COVID comes in as really the tip of the iceberg. And we've been lucky to seeing numbers that, when compared to the neighboring countries and around the world, we've fared quite well. But we also know that there's impacts on businesses and on people's livelihoods. We have clients that talk about not being able to sell at the market because not only is she HIV positive, she's pregnant, she's immunocompromised, and having that compounded with the fear of getting COVID-19 really sets her back. So now she's unable to feed her family and potentially unable to reach a health facility to get treatment. I mean, UNAIDS talks about an additional 500,000 deaths can happen if people are unable to get treatment. And the ones that will be most affected undoubtedly will be women, because they are the ones that are most infected with this disease. So definitely, how do we make sure that those on the ground and those that have the experience are being brought to the forefront and are talking about it?
Thank you, Ilda. Nina, briefly, what would you add to this?
So I feel like well-being and thriving are not a zero-sum game. And we have to lift up, as Davita said so beautifully and powerfully, the voices that have been most marginalized. So in the US, that's Black women, it's Black trans women. In Canada, where I am, it's Indigenous women and Black women. And I think we have to understand when those women are lifted up, we're all lifted up. We're all better. And I I completely agree. We have to, I came across something yesterday about white men in the US are 32% of the population, but they're, over 60% of elected officials, a
Yeah.
huge proportion of federal judges, huge proportion of Fortune 500 CEOs.
Yep.
And sometimes I worry when people just say reflexively, like, oh, we need women and we need Black women to be in those spaces. Yes, we do. But we also have to smash this table. It's not about being at the table as it exists. We have to smash the table. We have to remake the table in the image of Black and brown women, and those who have been left behind. So, that's a point I feel really strongly about when people say, oh, let's give women a seat at the table. I don't know that women want to be at this table because it's left so many people out. They need to remake the table. And just really quickly, as a physician and someone in public health, I think there is a real reckoning happening right now in medicine and public health around racism. And you'll read studies, you'll read a medical study, and they'll talk about race as a risk factor. I'm sorry, race is not the risk factor. The risk factor is racism. So we have to start calling it what it is. And we have to start teaching this in medical school. It's got to be a core curriculum. In public health school, in fact, in grade school, it's got to start much sooner than medical school. It has to be embedded. We have to start telling, the real history of these countries and these nations and how these nations were built. So, this is something I'm thinking a lot about. And as Divita said, certainly in the US, there is a crisis of maternal mortality among Black women. And it is independent of education level, of class, and so on. And it reflects racism in the system. Black women's symptoms are dismissed. And there's also a phenomenon called weathering, which, all of the stresses that Black women face over time create a sense of chronic stress and chronic unwell-being that then predisposes them to, and then on top of that, they're dismissed.
I mean, which leads me to, so I want to get to the point where we can maybe come up with some ideas of what could work or what should be happening. So in terms of in your positions, especially, so if you respond from the position that you're at, if you can give some examples of what's actually working to ensure that, again, I'm going to come back to that question, that women are not left behind in this. And actually, I'll start with Ilda.
Well, for us, our model has proven to work. I think Mentor Mothers, the testament that it works is that they've been deemed essential workers at health facilities, even in the face of COVID. Because we need to ensure that HIV services are there, maternal health services are still being offered. So I think having these peer-led approaches.
Sorry to interrupt. We only have 4 minutes. So I want to.
I would think,
yeah,
work with the women who've been through those experiences, and Mentor Mothers, in our experience, has worked.
Nina, how about you?
Yeah, just really quickly, we, in the programs that I work on, we are very big believers in supporting civil society, and governments change. They have a short outlook based on election cycles, but civil society is a constant force. And I think we have seen that if we invest in civil society in a long-term way, in a sustainable way, in a predictable way, things change. Society gets lifted up. And I think we've got to invest much more in civil society organizations led by Black women, led by Black trans women, led by Indigenous women.
Thank you. David, how about you?
Yep, two things really quickly that I think are working. The first thing is to be able to provide services and to center support and technical assistance around Black women so they can start their own business. And what that means to them is kind of economic power and freedom to be able to make choices in life. The three models, the one model that, of course, I want to lift up that I think is working, of course, is the model of Food Lab, where we center the voices and provide wraparound services to Black women in order to do that. Another one out in Oakland, California, or San Francisco was La Cocina. And another one in New York is called Hot Bread Kitchen. Love their work. And the number two thing that I think is working, I am absolutely inspired by Vanessa and Morgan. And those are the founders of an organization that's called Girl Trek. It is the most inspiring health movement probably in the world. They are the largest organization of Black women in the United States, and they have over 10,000 health activists who are helping women to do one thing, and that's walk.
Perfect. Quickly, I'm just gonna call out your name, and you tell me what's giving you hope right now. So, Nina, one thing that's giving you hope.
I have to say the protests in the U.S., I've gone through a state of not again, and what's going to change, to like being really depressed about it, to feeling some hope. I think the fact that people have been out in the street day after day after day, and we're starting to see some change. It's giving me hope, and we just got to keep it going.
Perfect. Ilda, how about you? One thing, quickly.
The resilience that we see in the women with which we work with gives me hope that there is a space to have a generation free of HIV. So resilience among women.
Perfect. Davita, how about you?
Yeah, I think I can't remember, and I don't want to give credit to this particular quote, but it's an old adage that they say they thought that they buried us, but what they didn't know is that we were seeds, and I think that gives me hope. Is that I come from the descendants of enslaved West Africans. They tried to kill us. I shouldn't even be here, but I am. And if my ancestors could survive the Middle Passage and chattel slavery, I know that now I can survive, and I have the willpower, I have the blueprint, I know the journey. That Black women, we will survive, and we are coming together as a community in the name of resilience and survival.
Perfect. Actually, and what gives me hope, it's the idea we can even have these conversations with amazing women like yourself on a platform created by women. And that gives me so much hope. So thank you, everybody. And thank you so much to our panelists for joining us. Really, this is a very important conversation. And I understand why WOW actually asked me to facilitate this, because this is something that I'm I breathe and live this conversation at all times. So thank you, everybody. I would like to give a special thanks to WOW for creating this space, and I would like to say special thanks to the BSL interpreters for making this session accessible to for those who need it.